Hello everyone, welcome to my channel. From now on, I'm planning to post some videos to teach you how to be a good neuroradiologist. This channel is very well designed to teach basics of neuroradiology to trainees, residents, medical students, and also fellows. And if we go further, we're just going to focus to more advanced in cases from brain, spine, and head and neck. So initially I would focus more to teach you guys how to read simple cases like head CT, CS spine, neck CT, like the basic principles. And then as we go forward, we're just going to move towards more advanced cases like brain tumors, follow-up head and neck cancers, and also I will show you interesting cases along the way, and also show cases that are more relevant for your board preparation if you are a trainee. So let's join to teach you how to look at a simple head CT. So if you're a medical student, or even if you're not a radiologist, like a neurologist or other specialty that working in the ER, and you want to know what specific things you have to look for head CT, here I'm here to tell you that what are the important windows and what are the important structures that we have to look on every single head CT. So imagine this is a patient like 20, 30 that coming through the ER with headache. This is a very common indication that patient present to the emergency medicine, or like overall is a very common complaint in the emergency department. So the common route for these patients like nowadays is just getting a head CT. So when we want to look at a head CT, we know that the CT, basically, I just want to tell you some principles about the head CT. We need to know that we have soft tissue windows, or basically here we're going to have brain window, and then we're going to have bone windows, and then we have different reconstruction. This sequence basically is the axial head CT, and then we have different reformats that usually done by our technologists in Sagittal and Coronal reformat, and then we're going to go over them as well. So first of all, when I want to look at a head CT, so basically we have to develop a search pattern for ourselves. So even we go from inside out, or you're going from outside in. So this is like your preference. If you set your search pattern from the beginning to go from inside out, you just always keep this search format in order not to miss anything, and in order not when you get like distracted by phone calls or like by other stuff in reading room, then you're not going to miss your important findings or important structures to be checked. So I usually start by looking at the inside out. So I mean the brain parenchyma first, and then I go to the bone and go to the soft tissues at the end. So this is your preference. You can go from like outside in. So you just decide. So first of all, I always look at the dura. So this structure is a dura. Make sure you look at your dura very well. So it depends on the age of the patient. Sometimes we have some dural calcification. Sometimes we have pathology like meningioma. As you guys see, I always look at this area very well. This is the area that patient when come with trauma, they can have hemorrhage. So basically I make sure that I look at my tentorium very well. These areas like called tentorial leaflets, make sure you can load tentorium very well. And then I look at my convexities. This is a very common area that basically we are going to have some subdural hematomas or extraaxial collection. So I make sure I look at my convexities very well, and make sure they are symmetric, and make sure I have brain parenchyma up to this inner table of the calvarium. If the patient is like old, you might have some atrophy and some distance, but I will tell you how to differentiate atrophy from extraaxial collection later. So I look at my convexities, I look at my dura, so I'm sure that there was no extraaxial fluid collection or subdural epidural hematoma along the falx, along the tentorium, or along the convexities. Now, what I do usually, I just go to the foramen magnum. So this structure is foramen magnum, upper cervical spine area, and I just try to look for any subarachnoid hemorrhage here. Sometimes that's the only way that you can find them, otherwise it's going to get missed. And then I look at my fourth ventricle, specifically here, right there. You're just going to have your fourth ventricle. I go up, I look at my basal cistern. You see that how this structure is very well, like I mean with CSF density here is very well like patent. It's not crowded or nothing. It's just like has massiving in this area. So this is very important. You always need to look at this area, supracellular cistern, to make sure patient doesn't have any herniation, doesn't have any hemorrhage, and we will look at the examples later. Okay, then you look at your MCA cisterns, you look at your Sylvian fissures, are very important structures to look for subarachnoid hemorrhage, as you guys see here. And then lastly, I look at my ventricles, make sure there is no intraventricular hemorrhage. So these are not hemorrhage. This is basically choroid plexus calcification. And then at the end, I just want to quickly look at the whole brain parenchyma, look at the sulci, and then make sure I don't have any subarachnoid hemorrhage that I miss. I look at these asymmetric appearance of the bilateral basal ganglia, look at the thalami, they are symmetric, there is no hypodensity such as evolving infarct, and then I look at my cerebellum. So if the patient is old, you might see some intracranial calcification. You see these vertebral arteries, even though this is a non-contrast head CT, but still you see the vascular structure. Sometimes you're going to even be able to recognize some aneurysm in the head CT. So now I just, when we are here, I always finish my actual sequence with look at the soft tissues. So you have this orbit very well, like globe looks very well defined. There is no hemorrhage. And then I look at the optic nerves. You see that there is a globe, there is optic nerve. And then at the end, I look at my nasopharynx. This is very important area in the nasopharynx. You want to make sure that there is no mass in the nasopharynx on your head CTs. This area you have to look for specifically, otherwise you're going to miss it. And then the other structure that is very important in head CTs is parotid gland. Sometimes we forget, we are rushing through the brain parenchyma for looking for hemorrhage, but this area, parotid glands, you should make sure that you look at it on every single case, because this is the area that you might see incidental tumors or parotid gland lesions or like other pathology going on. So make sure you always, every single case, look at your parotid, look at your nasopharynx. So this is our blind spots that usually may cause some incidental findings to get missed. And this is the paropharyngeal fat pad. We make sure it's just very well defined and there is no pathology here. Okay, so when I finish this, then the next thing I would like to look is bone window. So as you see in the bone window, so let's, if the patient coming with trauma, so basically we are looking for fracture, and then we have to be able to differentiate fractures from these sutures that you see. These have like this zigzaggy or a very harsh appearance compared to the fracture that they are just like linear, well-defined fractures that they are not like in the expected area of sutures. Sometimes it's not very easy to differentiate these two, specifically in small case. We have to just use our 3D reconstruction to just make sure we are not missing any fracture. So then I specifically look at for any basically I'm looking at the integrity of the bony structures, that there is no missing fractures. And as you see here, this patient has some chronic fractures on the bilateral nasal bones. And then we look at all bony structures, like this is the zygomatic arc, these are the maxillary sinuses. We look at the mandibular condyle, as you see here, these are mandibular condyle. We look at the pterygoid processes, and then look at the skull base. Every single case, make sure you look at the clivus and the skull base. This area is also a common blind spot that you can just, if you don't look at it, you're just going to miss it. So it's very important to look for this skull base and clivus. Then it depends like how your institution perform these head CTs and the area that you're just going to see in your field of view. So I see these ethmoidorsals, I see these maxillary sinuses, I see these sphenoid sinuses with some mucosal thickening, and then I see the maxilla. I look at it, there's some preapical lucencies. These are just very common people. And then this is the mandible at the end. And then the area I would like you to pay attention is carotid canal. Make sure there's no fracture going through the carotid canals. We're looking at the foramen ovale, we look at the foramen spinosum over here, and then at the end I always look at my masseter dorsals, and I go through the temporal bone anatomy later, but we can see like the principle or the basics of the temporal bone anatomy here as well. You see the external ear, you see just like the middle ear and ossicles, and you see inner ear structures very well. So make sure to look at them, specifically in trauma patients. Then so we have the same structures on the sagittal and coronals, but what you need to look specifically on every sagittal sequence, there are three structures that you make sure that you look and you don't miss looking at them. First of all, you need to have your midline structure. So basically you have your corpus callosum over here, and then you need to look at the area of pineal gland. Make sure there is no tumor here. There is some calcification regularly happens in people with aging, so it's very common, but we are looking for any tumor here in the pineal gland. We're looking at the stylotorsical and pituitary gland over here. Make sure we don't miss any tumors. And then we look at the cerebral tonsils. Make sure they are not low-lying here. So if I draw a line over here, you see that the cerebral tonsils shouldn't be low-lying below this line. Okay, and one more thing that I always like to look, this area that is retroclival area is very important to make sure that there is no hemorrhage here. So have a quick look in this area, and these are also subarachnoid spaces in the posterior fossa and upper cervical spine. And then when I have my bone window, I always look at this clive. It's very important structures, and it's a very common area for having pathology or metastasis or tumors. So make sure you always look at that in every single head CT. And then finally, I quickly look at this. And the important thing about the coronal views, I would like you guys always look at the DORA on your coronal views, because this is the area that if you don't see it on axial, you're going to pick up the hemorrhage on this. So you see that you anterior and posterior, always follow it correctly. And then on your tentorial, make sure that there is no hemorrhage, there is no subdural. And then I look at these again, convexities, ventricles, and at the end I look at my optic nerves here. You see that the optic nerves coming to the orbital apex, and then you have a very nice view of the pituitary gland again, and this is the optic chiasm, pituitary stalk, and then here you have your cavernous sinuses. So again, you look at your soft tissue structures quickly. You make sure that there's nothing in the parotid glands or like outside. In trauma cases, you have laceration, you might have large hematomas. So this is another thing that you need to know and pay attention. So this is a basic search pattern for head CT when you're looking. So basically you go from inside to out, and specifically look for hemorrhage, you look for loss of gray white matter differentiation, for territorial infarct or other pathologies. You always look for mass effect. So basically what it means, you see that we have a midline here, so every structure, like, they are mirroring each other. So basically we don't have any shift of midline structures, which is a sign for early herniation or mass effect. You don't see any vasogenic edema as hypodensity on CT, and as I showed you earlier, these suprasellar cisterns are widely patent. It means that there is no uncal herniation. And then we also need to look for uncal herniation on the coronal always, because we want to make sure there is no uncal herniation based on this view. So basically on head CT, usually you can get a lot of information. Depends on the indication. We look for hemorrhage, we look for mass effect, we look for initial or secondary tumors in the brain, like a primary neoplastic process or metastasis. And then we also can see large vascular infarct. Sometimes early stroke is difficult to see by head CT, but as it evolves, we are going to see hypodensity and loss of gray white matter differentiation, which is basically based on developing edema in the brain parenchyma. And then, as I said, depends on indication. We're going to see fractures in case of trauma. There are so many like indication for head CT, and this is usually kind of screening for clinicians to start with head CT, and then they go from there. And if there is any pathology, we decide to do another MRI or other subsequent scans. Okay, just want to make sure that you guys always know to pay attention to other structures. Just don't focus on the indication. We need to know if there's an incidental, any parotid tumors, any nasopharyngeal tumor, or any skull-based mass. Thank you for your attention.